Vaccination by San Ernestine, DTCC, Terry Campus, Miss Tobias. Introduction. What was your topic? How did you decide on this topic? Is it related to your major career plans? My topic was vaccination. I decided this topic because I wanted to know more about vaccination. And is it healthy for people to take? No, this is not related to my major is education. My career plan is to become a teacher. What are 3 or 4 of your major research questions? How was it difficult to find the answer? My research questions: can you still get COVID if you're fully vaccinated? Should I get COVID-19 vaccine if I had COVID? What are the consequences if you're not getting the COVID vaccine? And why should I get the COVID vaccine if I can still get sick? How can vaccines work? Do they work against virus and bacteria? Is it natural immunity better than vaccines acquired immunity? Do vaccines cause autism? Why did all vaccines 100% effective? Why do some vaccines require boosters? It wasn't difficult to find the information for my research questions because it was easy. What was your thesis? Did you change at any point throughout the writing process? My thesis statement is the vaccine have dramatically reduced or eliminated once prevented and devastating diseases in children and adults. Although some people say that you should get vaccinated, that the vaccine doesn't work. It gets you sick. And it must for people to have no, I did not change my thesis. I kept the thesis statement the same through the writing process. Claims and arguments. What are claims, counter arguments, and rebuttal? What were the major battlegrounds for each point? Discussed as much evidence as appropriate. Benefits of vaccination outweigh the risk. Serious side effects that could cause a long-term health problem are extremely unusual following any vaccination, including COVID-19 vaccines. Vaccinations. Vaccines do not impact or function, especially as related to autism. The Pfizer and Moderna vaccines were created using messenger RNA or mRNA technology which has been used for 10 years in cancer treatment with no long-term effects detected, and even before that, scientists had been working with the mRNA technology for years. mRNA technology does not alter your DNA. Vaccines reduce the health risks for you cannot tolerate the vaccines for other health reasons. These cases typically occur in male adolescents and young adults after the second dose and within a week of vaccination. It is important to seek medical care if symptomatic chest pain, shortness of breath. Treating the disease, the safety of vaccines is important from beginning to end. When a vaccine is developed, it goes through a strict, detailed process overseen by the U.S. Food Drug Administration, FDA. The FDA must prove the vaccine is safe before it can be given to people. Many preventable diseases are dangerous and can cause lasting side effects. It's much safer and easier to get vaccines instead. Plus, being vaccinated helps keep people for you caps keep you from spreading the disease to unvaccinated people around you. Vaccines had proven to be safe and effective, but the topic can still be stressful for some patients. Plan to discuss the COVID-19 vaccine during each telehealth appointment with an unvaccinated patient. Conclusion. What were two or three of the most interesting things you've learned from your sources? While addressing, consider the following: why additional background knowledge was needed to help you understand certain source material. Why were these items so interesting? Why were they shocking, disturbing, or reassuring in any way? Most of the information was interesting to learn. The first was I didn't know about vaccines are safe for people. Second, the vaccines or antibodies, which I didn't know that. The last thing that I didn't know that science was working on the vaccines. They were interesting because I did not know these things. I learned that it was surprising. In conclusion, I think that vaccinations are a great thing for adults and children. Vaccines are safe to get in the future. I will need to research more about shots and why the shots could get people sick. Vaccinations should exist because shots are making children and adults healthy. The takeaway in this is that vaccination help you prevent you from getting sick. Vaccination prevents you from getting blood clots and it helps your immune system not to give up. Vaccination has dramatically reduced or eliminated once prevailed prevailed prev- prevalent prevalent and devastating disease in children and adults. Vaccines mm, do not impact brain development or function, especially as related. That's all my thing, and bye.